is National Breast Cancer Awareness Month, and we want to call attention to the deadly disease.
Joining us live this afternoon is Dr. Lisa Curcio. Wanted to get that correctly. How are you doing?
I'm doing great.
So you're a surgical oncologist, but you're also a breast cancer survivor yourself.
Yes, I am. I was diagnosed with breast cancer at the age of 38.
So is this something that ran in your family?
No.
Okay.
But I was having a breast symptom. I had a mammogram, and that mammogram saved my life.
Okay, so, and that's one of the points why you're here, is to talk about mammograms and the importance of it. Two things, twofold. People who have experience or have that in their family, they should go at a certain time, and then the average woman should go at another time.
Right. There's a lot of confusion about screening mammograms right now, and even physicians don't exactly know what to do. But those of us who are in the trenches taking care of breast cancer patients, we really firmly believe that the average woman who doesn't have risk factors should start their screening mammogram at age 40 and get their mammograms yearly. We know that mammograms save lives and reduce the risk of dying of breast cancer by 30%.
We know that genetic testing is something that's widely used right now in the medical field. Is it being used to detect breast cancer?
It's not being used to detect breast cancer, but it's certainly being used to detect those who are at higher risk for breast cancer. So they may start their imaging earlier, and we may use supplemental imaging, like things like breast MRI for those patients.
What are the risk factors?
Well, being female and being older, that's a risk factor you really can't control. But there are lifestyle risk factors. For instance, alcohol use, smoking, being overweight, and being on prolonged hormone therapy are all associated with an increased risk for breast cancer. And those are controllable risk factors.
You would think that smoking, obviously that was the first thing that popped in my head, but I wouldn't think alcohol.
Alcohol has, each glass that you have, if you drink daily, each glass is a 10% increased risk.
That is so high.
And if someone's listening right now, they just heard you say, well, women, that's a risk factor. When you say that, because men are also victims of breast cancer.
Breast cancers in men. A lot of those males will have some hereditary predisposition like a BRCA gene, but we don't do screening mammograms on men, so men should just be aware, examine their breasts when they shower, and if they feel something, bring it to the attention of their physician.
Would you say that maybe overweight men are more at risk for it? Or?
It is, obesity is a risk factor also in men, and also having an entity called gynecomastia where the breast tissue develops more in the men as opposed to someone who doesn't have gynecomastia.
And what about if someone's watching and they have not gotten their mammogram in the last few years, they're just sort of procrastinating on it? As a breast cancer survivor and also as an oncologist, advice?
Mammograms save lives, and we know that if we detect something on a mammogram before we can actually feel it, the survival rate is in the 90th percentile. So don't wait. If you haven't had your mammogram, start now. Better now, late now than never.
Our colleague Lynette Romero, I think she did a mammogram, and then after she posted about it, she said it was really uncomfortable but very necessary. If someone's at home right now and they never had one before, is it painful? Is it a painful process?
Not everyone has pain associated. I think a lot depends on if they have breast pain with their periods and things of that nature. But the majority of women, it's so quick, and it really, if the pain is there, it's for several seconds at most.
All right. Doctor, thank you.
Yeah,
nice to have you here with us. We appreciate it and love your pink blazer.
Thank you.
And pink fingernails, too.
And pink fingernails.
Like
I noticed those as well. All right, we'll be right back.